Before I enter the patient room, I will check the patient chart. The doctors have placed an order for an ABG. I will review the patient chart for significant findings. The patient is on heparin, and also if the patient is in contact, so I could use the proper PPE. I knock the door. I wash my hands. I enter the patient room. I introduce myself to the patient. Hello, Mr. John. My name is Maria. I'm a respiratory care student. I'm here to do an ABG, which is the blood work. And before after I introduce myself to the patient, I go back to the patient chart. I record if the patient is on room air. I record the normal FiO2. And of course, I identify the patient, make sure I have the right patient by telling them to verify the last name and date of birth, and date and time of the test. And I gather my equipment. Alright, and before I start the ABG, I'll perform the modified Haaland test. I'll tell the patient to raise their hand, and I'll press the palpate for the radial artery and the ulnar, and then I tell the patient to squeeze their arm and release, and squeeze and release, and then I release the ulnar, and then I look for recirculation within 10 seconds, and I place a towel under the patient's arm to hyperextend the patient arm, and I'll tell Mr. John I'm gonna clean my site. Also clean my gloves. Alright, Mr. John, you're gonna feel a little pinch. I want you to stay still, okay? Ready? And I will press. Cut my needles. I'll apply pressure for 3 minutes. Pressure band-aid on, keep applying pressure. Cover, and I'll start mix it with the heparin. And then I will discard my needles, my needle cap into the sharp container, and I will place my sample into the bag. If I'm not going to use the sample within the next 30 minutes, I'm gonna place ice in it. And if the sample stay out more than 60 minutes, I will discard the sample. After I finish, I clean away my garbage, and I take my gloves off, wash my hands, and exit the room.